Hi everyone, welcome to Boston Children's Hospital YouTube Live for December. I'm Brian McKeag. We have got a great topic today, all about RSV and flu season and of course COVID-19 for your children and what you need to know. We've gotten lots of questions that we're going to answer, and our special guest is Dr. Kristin Moffitt. So, Kristin, why don't you introduce yourself and
Sure.
talk about your background?
Yeah, sure. Thank you so much for having me here today.
Thank you for being here.
Yeah, I'm Kristin Moffitt. I am a clinician in the Infectious Diseases Division at Boston Children's Hospital, and I have been at Boston Children's for, almost 20 years now. So,
Fantastic.
Yes. Mm-hmm.
So please keep submitting questions. We're going to try to get to all of them, and then while this is live, we're going to be archiving this on our YouTube page, on our channel for Boston Children's, so you can share with family and friends afterwards to share all this great information. Let's start with RSV and the vaccine and who could be approved for the preventions, and I just think there's just a lot of unknowns about RSV, and it's so in the news. I'm sure a lot of parents are concerned and have questions.
Yeah, it does seem like there are a lot of questions about RSV. It's getting more attention than ever. I think it is important to just remember, though, that RSV has been around for a really, really long time, decades and decades that we've been able to diagnose it. It's one of the most common causes of viral infection during the typical respiratory viral season, which we're right smack dab in the middle of right now. Right. It is so common that almost everybody has been infected with RSV by the time they're 2 years of age. And
a parent might not even know.
Parent might not even know. It might just look like the runny nose and congestion that lasts a few days and goes away. As a matter of fact, for the majority of individuals who get an RSV infection, it looks a lot like the common cold with lots of runny nose and congestion, maybe a little bit of fever, but it tends to be fairly mild. There are some populations, though, that are more susceptible to more severe RSV infection, and those tend to be young children, especially very young infants who've never had an RSV infection before, and they also have smaller airways that are more prone to leading to respiratory distress if they got infection that moved into the lower airways. The other population that can get sicker from RSV infection tend to be older adults, particularly those over the ages of 60 and 65. People with immunocompromised conditions and other certain medical conditions that might involve lung disease and other things might also be at risk for more severe RSV infection. So it is big news this season we have, for the first time ever, ways to prevent RSV infection really in our most susceptible populations. So for the first time ever, we have a monoclonal antibody that is approved initially for all infants under the age of 8 months. It unfortunately has been met with supply chain issues and pretty significant shortages. So the CDC has updated the guidance in terms of who to prioritize for RSV monoclonal antibody administration now to include infants under the age of 6 months coming into this RSV season or within this RSV season. It still is very hard to find, unfortunately, for a lot of families right now. We hope that that won't be the case in future RSV seasons.
Right.
We also have 2 vaccines that have been approved now for individuals over the age of 60.
Right.
And so that's really exciting. And one of those 2 vaccines has also been approved for pregnant women who are 32 to 36 weeks along in their pregnancy during this RSV season. And in pregnant women, that particular vaccine showed very good effect at decreasing the likelihood of a severe RSV infection in infants in their first 6 months of life.
Wow.
So it's amazing how much we have now to offer. This is the first season we've had it. We've had all of those preventive approaches available, and so that is very exciting.
That's great. So for a parent watching who has a baby younger than 6 months, what should they do? Talk to their pediatrician? Like, what's step one?
Yeah. Talk to your pediatrician is always step one. We are hearing a lot about parents that are really frustrated about the shortage and difficulty in finding the monoclonal antibody for their infant under the age of 6 months. I would say that there's another monoclonal antibody that we have been using for about 15 years now that has been exclusively provided for very young infants or infants under 2 years of age who have certain underlying medical conditions that put them at increased risk of severe RSV infection. Right. And their child may either still qualify for this newer monoclonal antibody that only needs to be given once in an RSV season based on an underlying medical condition, or even if that's hard to find, they may still qualify for that other monoclonal antibody that we've been using for a longer period of time, but that one has to be given once a month during the RSV season. But there are options, especially if your child has an underlying condition that puts them at risk for severe RSV.
Right.
So definitely talk to your pediatrician. If you have one of those very young infants that doesn't otherwise qualify for either of those antibodies and you can't find it, I would just remind families that we have been dealing with RSV infection in young infants for decades now, and that the measures that we have used would still be the same ones that would apply now this RSV season, which is to do your best to minimize exposure of your very young infant, particularly to people who may be sick, asking those who are in contact with your young infant to stay away if they're sick, to wash their hands if they're going to have contact with your infant. If you've got other little ones or kids in the home, if they are having any respiratory symptoms, doing your best to keep them away from the very young infant. All of those things can go a long way towards keeping that infant healthy.
And if you, when you're with your infant, and if you're confused or you think maybe there might be some symptoms that might be related to RSV, is there a certain RSV cough or a certain RSV wheezing? Or again, if there's some sort of flu-like symptom, call your pediatrician? I mean, how do you triage that?
Yeah, no, it's a great question. If your infant is just having a bit of a runny nose, but no fevers associated with it, they otherwise seem to be okay eating and drinking, and they're keeping hydrated, and they still look active, then it's okay to just sort of move forward with supportive treatment. A lot of families may be familiar with the little bulb suctions that they're shown how to use before they leave their birth hospital typically.
I remember those.
Yeah, to try and clear some of those secretions away. I always tell families we have to remember babies tend to be obligate nose breathers, which means they really prefer to breathe through their nose. So if their nose is blocked up with congestion from a respiratory virus, including RSV, it does make it more difficult for them to breathe and eat from a bottle or breastfeed or however it is that they get their nutrition. It's harder to do that when they've got a lot of congestion. So in those instances, doing their best to sort of clear those secretions away, particularly before attempts to feed an infant, can be really helpful. Otherwise, if you have a very young infant that develops a fever, particularly an infant under the age of 2 months, that would be reason to talk to your pediatrician right away. If at any point in time there are concerns that the congestion has turned into more of infection or an illness associated with any difficulty breathing, it looks like they're using extra muscles to breathe, they're flaring their nostrils to breathe, they should get an evaluation with a physician or at a medical office right away.
Okay. And I just want to go back to the maternal vaccine because that is new. Maybe just re-emphasize. I'm sure folks watching may know someone who's pregnant. Again, let's just review that again because I think that's important.
Yes. So a woman who is between 32 and 36 weeks in her pregnancy is eligible for the RSV vaccine. And that applies to any woman who's 32 to 36 weeks any time during the RSV season or in the month leading up to the RSV season. The goal there is that that pregnant woman could get the RSV vaccine. She develops antibody that will be protective against RSV infection. And at that stage in the pregnancy, that antibody gets transferred to the infant through the placenta. And so those infants are born with pre-made antibody against RSV. And it actually demonstrated very good effectiveness at preventing some RSV infections to some extent, preventing infection at all, but even more importantly, preventing severe infection or infection that required a visit to an emergency room or anything like that in the clinical trials. So very exciting to have that to offer. Yeah.
And then just to wrap it up with RSV, like you said, most children have gotten RSV by their second birthday.
That's right.
So for the majority of kids, this is standard.
That's right.
It's just those very young and very old folks.
That's right.
To be concerned and again, talk to your pediatrician. So let's move to COVID-19. So I'm sure, again, another similar symptoms that I think would be very confusing for a parent. How do we, I know some of the measures have changed and testing, of course, so how do we dive into COVID-19 with with children?
Yes. I will start by saying COVID-19 is still with us.
Right.
It now is just part of the mix of all of the respiratory viruses that we tend to see that peak during this respiratory viral season. So really the approaches to testing and isolating and potentially to treating have not changed now that we've moved out of the more urgent phase of the pandemic. I still recommend that families have home testing kits for COVID-19 available. Those have become available for free again, a certain number of them, through, I think there are links to that through the government and CDC websites.
Yep.
They're obviously available for purchase through retail pharmacies. Having those in stock would be a very good idea. Most pediatricians' offices still are offering the test for COVID-19. It often includes testing for potentially influenza and RSV as well. Exactly as you said, it can be really difficult to distinguish any of those infections based on symptoms alone. There's a lot of overlapping symptoms.
Right.
COVID-19, what we are seeing right now in terms of infection, most people are experiencing more mild infections than we were when this virus was emerging. And that's for a few reasons. The most likely one is that almost all of us have now been either infected with COVID-19 or SARS-CoV-2, the virus that causes COVID-19. We've had vaccination against COVID-19, or we've had a combination of those two things. That immunity does wane over time.
Right.
We also know that the virus has changed over time. And so, as people may be aware, there are updated COVID-19 vaccines that were updated for this 2023-2024 season that are better adapted for the currently circulating COVID-19 strains. So I still would encourage everybody who has not had a COVID-19 infection in the last few months and who has not yet received one of these updated COVID-19 vaccines to get the updated COVID-19 vaccine. Right. The time is now. We are just starting to see COVID-19 on the rise again. I think it seems like it's starting to fall into more of a seasonal pattern for COVID-19 transmission. We saw a very little bit of it kind of through the summer and in the fall, but it's starting to look a little bit more like our other respiratory viruses. Transmission is definitely on the rise right now. I think it's really hard to say for sure how high transmission of COVID-19 will peak now this season with all of this immunity that's on board and with the variants being different than they used to be. But now would be the time, especially if families are about to travel or gather with family for the holidays. It would be a good time to do everything that families can to get themselves and their children protected against COVID-19.
Right. I'm sure people watching feel like, I'm a healthy young parent. Why would I need that? But really it is, to your point, for your to protect your children and to protect your older relatives if you're going to be visiting them.
Definitely.
Yeah.
Yep.
So is there, let's say, you've now figured out your child or toddler or grade school kid has it, and you do the test and you get positive. How long should they stay out of a school?
Yes. So the isolation is still 5 days.
Okay.
And that 5-day marker starts either at the time that symptoms began, or if a person tested for COVID-19 because the rest of the house had COVID-19, but they never developed symptoms, but they tested positive, then that 5-day countdown starts when the test was positive.
Right.
So really doing your best to isolate at home during those 5 days would be really important. Even for the next 5 days, leaving the house, if individuals can safely wear a well-fitted mask for those first 5 days after their 5 days of isolation, that would be an additional layer of protection for others that they may be around.
I'm sorry, say that again. So after your 5 days of isolation, the next 5 days is what you're saying.
Yes.
A well-fitted mask.
Correct.
To be out in public.
Correct.
Okay.
Yes, that would be the safest thing. We know that the infectivity of COVID-19 decreases substantially by day 5, especially if someone is feeling really good by then. But it doesn't drop to 0. So still doing your best to protect those that you might be around once you've completed that isolation would be important. When it comes to return to school or return to daycare, I think a lot of schools and daycares are following those CDC guidelines for the 5 days of isolation. But I would just recommend everybody review your school's specific illness policies, your daycare's specific illness policies. There may be slight differences in there, so just make sure that you're up to date on those.
Great. And please get the booster.
Yes, I would definitely recommend the booster.
Okay.
Yeah.
Anything else about COVID-19 that we've missed or we you want to cover?
Yeah, I think those are really the main points. I think that
You must get these questions all the time.
we do get these questions a lot. I can totally appreciate that people just probably got really tired of hearing about COVID-19 and talking about COVID-19, but that doesn't mean that it's not with us and that it's not capable of contributing to significant disease.
Yeah.
So really important to keep it in mind and to take advantage of everything we have to protect ourselves and our loved ones.
Right. Okay, so finally, let's talk about the flu.
Mm-hmm.
Now we're, and you talked about this spike. The flu season is just starting.
Mm-hmm.
What, again, similar symptoms, similar precautions, but there's no vaccine. So how, tell us, how do we now keep that in balance with RSV and COVID-19 in terms of prevention?
Yeah, well, there are vaccines.
For the flu,
vaccines.
I'm sorry.
Yes. Yeah.
Of course there is.
Yeah.
I got mine.
No, yeah. And so flu vaccination is so important.
Right.
Flu vaccine has shown us for as long as we've been using it that it can be very effective at preventing hospitalizations due to the flu, severe infection due to the flu. So I would absolutely recommend that anybody who hasn't gotten their flu shot to get their flu shot. And I get the question sometimes, well, we're already in flu season. It's probably too late. Well, flu season goes on for a long time.
Right.
And it tends to have two peaks. It's been thrown off a little bit because of the COVID-19 pandemic, but prior to that, we typically have the first peak, which I think we're experiencing now, which happens right around this time, sort of December, and maybe starts to wane a little bit into January. And then we do tend to have a second peak that typically peaks in February, may kind of linger into March, but we can see flu transmission well even through March and into April.
Right.
So it's not too late to get a flu vaccine. As you probably know and viewers would know, that the flu vaccine does get updated every year.
Right.
So if you had one 2 years ago, it's not going to do anything
Right.
to protect you against flu this season. So it would be important that if you've not had one this season, to go ahead and get one.
And what do you do if someone in your household has the flu?
That's a great question. Yeah, like any of these respiratory viruses, the best thing that families can do if somebody starts to have respiratory symptoms, if it turns out to be due to the flu or other viruses, frankly, would be to do your best to isolate that person. It's not possible for young children, of course. They need care from the older individuals in their household.
Right.
But if that were the case, wearing a well-fitting mask when you are around the person with symptoms who you can't isolate from would be really important. I otherwise would recommend that if somebody is starting to develop symptoms of a respiratory infection, getting stocked up on whatever the family may need for fever prevention.
Right.
Fever can be a symptom of a lot of these infections. Getting stocked up on whatever is going to be most helpful to keep that person hydrated.
Right.
Dehydration is one of the ways in which children with respiratory infections get into the most trouble. They don't feel great or they're really congested. Infants, as I mentioned with RSV, might stop drinking or taking in as much nourishment as they need. So dehydration can really get kids into trouble when they've got respiratory viruses.
Okay.
So taking all of those steps to sort of be prepared would be really important. When it comes to influenza infection, if your child or someone in your household is demonstrating symptoms that might be consistent with the flu, which again are really difficult to distinguish from
Right.
COVID, from RSV,
Right.
from other respiratory infections, talk to your provider right away, especially if someone in the household has any of those underlying conditions that might make them susceptible to more severe infection. Antiviral medication for the flu might be recommended for certain susceptible populations. It typically would be recommended for a child with influenza who's under the age of 2. It would be recommended for a child with underlying respiratory disease who gets influenza. So if your child or anyone in the household is developing symptoms, it would be a good time to talk to your provider and review if any of those antiviral medications might be considered for them.
Great. And again, the flu vaccine, it's not too late. We're
not
here,
too
it's
late.
December. We're going to have another spike. It's not too late to get
We are still in the heart of the rise of this
the
spike.
first spike, yeah.
And there's
Yeah.
a very good chance that we will have a second spike. It feels like with the timing of the onset of this RSV season and flu rise, we might be returning this respiratory viral season to more typical patterns of transmission. So we might
Right.
well see a second spike.
Right. Gosh, it's so hard for parents
It's
with
a lot.
these
It's a lot.
three major
Yeah.
diseases that have so many similar symptoms.
Yes.
Well, anything else to add about the flu and prevention and I love stock up fever prevention,
Yeah.
and then that dehydration is so important.
Yeah, I think those are things for the majority of people who get any of these infections. The treatment's really going to be supportive.
Yeah.
So it's going to be keeping them hydrated, keeping them comfortable, and keeping an eye out to make sure the symptoms haven't progressed to any of those more severe symptoms.
Right.
So anything that might be a sign of dehydration or that might look like increased work of breathing or respiratory distress should really prompt a discussion with your provider and an evaluation right away.
Perfect. Good. Okay, we've got lots of questions that have been submitted. Let's start with the first. Is it possible to get an RSV vaccination for a young adult who is immunocompromised? I was told they can't give it to anyone who is younger than 60 or pregnant. Also, my daughter has asthma and gets bronchitis easily. I'm concerned about this as well.
Yeah, that's a great question. Currently, the available and approved RSV vaccines are only approved for those over the age of 60. And one of those two vaccines, there are two that were approved, one by Pfizer and one by GSK,
Right.
both approved for over the age of 60. And the Pfizer one is the one that's been approved for use in pregnant women. So if you don't fall within either of those two populations, there is not an available and approved vaccine yet. And the reason for that is because those other populations were not included in the clinical trials that ultimately led to the approval of these vaccines.
Right.
So the clinical trials really focused on those largest populations for whom an RSV infection might be more severe.
Right.
I will say, though, that those RSV vaccines are being actively studied in people under the age of 60 and down to young adulthood. I suspect we may even have some other pediatric trials of those RSV vaccines, particularly for children with some of those underlying conditions that put them at risk for more severe
Like
RSV
the
infection.
asthma discussion.
Exactly,
Yeah.
exactly. So the expansion of the approval of those RSV vaccines won't come until those data are available. It's really important to demonstrate both safety and efficacy
Right.
of these new vaccines in those populations, but hopefully more to come.
Okay. Here's another question. There has not been a lot of emphasis this year on getting the COVID shot for kids. Why is that? What are the pros and cons of getting the COVID shot for kids?
Yeah, I think that the strategy for sort of broad recommendations for the COVID vaccines this year has really prioritized vaccinating the populations who are most susceptible to severe infection. So I have seen a lot of push publicly and in different ad campaigns to really make sure that individuals who are either elderly or have underlying conditions that put them at higher risk for a severe COVID-19 infection, we really focus on getting those individuals as up to date with the updated COVID-19 vaccines as possible. So I do feel like that happened at a bit of a cost to more broad recommendations
Right.
for the COVID-19 vaccine, but they are still broadly recommended. And the reasoning for that is, as I discussed before, immunity either to prior infection or from prior COVID-19 vaccination wanes over time.
Yep.
And these currently updated boosters have been modified to better target and provide better immunity at the currently circulating strains.
Right.
So it would still be really important to stay as up to date on your COVID-19 vaccines as possible for yourself and your children. So the pros really are that getting that vaccine on board, it does reduce the likelihood of COVID-19 infection in your child, but even more so, it reduces the likelihood of a severe infection in your child.
Right.
Now, severe infections in otherwise healthy children are not all that common, but they do happen. We do see otherwise healthy kids get hospitalized with COVID-19. And it's very difficult to predict which of those children
Right.
might land in that situation. So doing your best to get immunization on board for all eligible individuals would be really important. The cons are really minimal. I mean, these vaccines, we've given millions and millions of doses of these vaccines now to children, and they have demonstrated themselves to be safe and effective. The most likely side effects from a COVID vaccine are very similar to the ones from an influenza vaccine.
Right.
So it might be some soreness, some redness at the site where you get the vaccine. An even smaller percentage of people might feel a bit run down, may even have some low-grade fever after getting the vaccine, but that tends to be very short-lived.
Right.
So if you're weighing the potential adverse reactions to a vaccine with the possibility of a COVID-19 infection that might have you have to isolate for 5 days or might be transmitted to other people who are at higher risk for
Like
severe infection,
with
it's
these
a big
holidays
deal.
coming up.
Exactly,
Right.
yeah.
Or not even be able to participate with the holidays because of an early infection.
Exactly.
That would be
Yep.
a big bummer.
Yep.
Okay, here's another question. When a child is diagnosed with COVID-19, how likely are they to get it again? And is it more serious than RSV? And should we be as concerned with both? How long do COVID-19 symptoms usually last in children and babies? Thank you.
Okay, that's a few questions in one.
So, yeah.
keep me honest. But so to start,
Will they get it again?
Will they get it again? Yes, it's very possible that people do get recurrent COVID-19 infections. I know people who've had it 3, 4, or 5 times.
Right.
It's unlikely that you will get a COVID-19 infection within the 3 months after a COVID-19 infection.
Okay.
The immunity that you get from infection seems to be very good for at least that long. But outside of that window, if there's still a lot of COVID-19 transmission, people do remain susceptible.
Sure.
The symptoms, I think, was it RSV and COVID
Right.
and whether they overlap?
Is it more serious than RSV? Should we be as concerned with both?
Yeah, it really depends on the age and if there are underlying medical conditions for the infected individual. RSV is definitely can be a more severe infection in very young infants, so particularly infants under the age of 6 months.
Right.
COVID-19 tends to not have that sort of likelihood of causing more severe infection in the very young. It is a little bit more, I guess, what would be the word, non-discriminatory in terms of ages of young children that it might infect and might cause severe infection in. So I would say that those with underlying conditions that put them at risk for severe COVID-19 include certain immunocompromising conditions. There's a lot of overlap there between what might put someone at increased risk for severe COVID-19 and increased risk for severe RSV.
Right.
So I wouldn't say that either of them is more or less serious than the other, but there are some age-based and sort of medical condition-based differences in susceptibility to severe infection.
Love it. And then the final, how long do the COVID-19 symptoms usually last in children and babies?
Yes. So typically, RSV tends to last about 3 to 5 days. COVID, the symptoms tend to last about 3 to 5 days. But as with any of these infections, some of the symptoms can persist for longer.
Right.
Yep.
Well, this is amazing. We've gotten great questions, and I know I've learned a lot. And I want to thank you, Dr. Moffitt, for joining us. And thank you for joining us live with our Boston Children's Answers YouTube live event. We're going to be doing this every month, and again, this will be archived on our YouTube channel that you can share with family and friends. But thank you again for joining, and we will see you next month.